Why checking for gluteus medius or glute strength imbalance and how they assist in everyday movement? We have tested sideline hip adduction on Alessia. Make sure the pelvis stays neutral and have someone to add resistance to the leg. You just need to lay down and kick sideways and resist against the resistance without compensating of kicking forward and twisting the hip. Repeat the test on both sides and see side-to-side strength imbalances and side-to-side differences. Alessia had lower back pain, and I will explain to you later how uneven forces go through the spine or lower back when having weak hip stabilizer muscles. When your glute medius muscle becomes weak, it allows your thigh to rotate and pull inwards, creating unoptimal movement pattern. This is called a collapsic kinetic chain, which means your body is working together to perform movements like a chain reaction, whereby energy or force generated by one part of the body can be transferred successively to the next part of the body. For example, as shown on the picture. For example, as the result of weak gluteal muscle, abnormal position of the thigh can put excessive stress and strain around your knee joint. A very common result of this is an ACL injury. But also, if this fails to fire up, the IT band might have to take its role, which can become tight and also cause lateral knee pain. As the gluteal medial is an important pelvic stabilizer muscle which affects posture, gait and stability in the hip, knee and ankle joint, causes loss of stability throughout the lower body and also can cause ankle strains repetitively or ligament damage. You can also have hip compression, feeling pain in the front hip while running from weak glutes, which you would think is cause of tight hip flexors. As a pelvic stabilizer, it controls different planes of movement like rotation and side-to-side movement, and it provides stability to the lumbopelvic hip complex, which is why we can also have lower back pain when having weak gluteal medial muscle. This stabilizer might be important controlling excessive movement and avoiding uneven forces transferring through the spine. Gluteus medius weakness and loss of dynamic lateral stability of the pelvis and lower back can lead to increased lateral trunk flexion. It can also affect the gait as it works to maintain the side-to-side pelvic that drops, therefore allowing the other limb to swing forward for the next step.